So without further ado, I want to introduce our presenters for today. We have Nancy Rodriguez and Wilma John. We hope that you all enjoy this presentation. Thanks so much. Nancy and Wilma, feel free to take it away.
Great, thank you, Susan. Hi, everybody. My name is Nancy Rodriguez. I'm the Executive Director of the New Mexico Alliance for School-Based Healthcare, and I'm joined by our Program Manager, Wilma John. And she's probably at my screen. She's the next screen over, and she and I are going to both present, and we're going to go back and forth. And she is going to be controlling our slide presentation. And I think you're going to get this slide presentation in the chat box. We will try to get it and post it up on our website as well. There's some handouts that are already in your chat box. Those are also on our website in case you need those or want to distribute those in your school settings where you work. The name of our presentation today is Asthma Environmental Triggers in the Era of COVID-19. We want to thank you guys all for coming. I'm very cognizant of the fact this is Friday afternoon before Labor Day. And so I am thrilled to see such great attendance. I'm not going to assume that you guys are not able to go anywhere this Labor Day, and that's why you're here with us. I'm going to assume you love talking about asthma environmental triggers. So thanks for making the time in your busy schedule. And just to give you a little bit of background about this presentation, we have created some tip sheets and work with partners who have tip sheets on this topic that are built into this presentation. And a lot of that work has been in collaboration with the Department of Health Asthma Control Program, and a number of the team from that group are on this presentation and can help answer questions. We also have worked for about the last 3 years on this topic with RAMP, which is out of California. They have had a Kellogg-funded project to look at school-based health care, and not just school-based health centers, but school-based health care and asthma environmental triggers. So we've been working with those guys for about 3 years. So some of the tools you're going to see we did in partnership with state partners and some with national partners. And what we've learned over those 3 years is that in addition to the clinical work that all of the clinicians do, there's also a role for school staff, including school nurses, school administrators, and their healthcare partners to play in addressing the triggers that may be present on the school campus. So that's what our focus has been. And I want to emphasize that neither Wilma nor I are clinicians. And so you guys, many of you are RNs, I know on this call, social workers, so you may have unique perspectives. So we'll consider everybody who is participating today an expert. And when we get to the Q&A session at the end of the presentation, some of you may have experiences on your school campuses or in your sites that could be helpful to your colleagues. So please feel free to share. So these are our session objectives. We're going to have you guys identify 2 environmental triggers and discuss how students or patients with asthma can take appropriate precautions to mitigate the spread of COVID-19. We're going to identify a strategy to assess and reduce indoor environmental triggers when cleaning schools and spaces upon re-entry to schools. For some folks, I know that's already started for you. Some of you, it may start on Tuesday. So we're hoping this is very timely for you. And lastly, we're going to identify at least one strategy to assess and improve the school environment by creating safer indoor and outdoor spaces upon re-entry to schools. We've seen a lot, especially of childcare settings, start using more and more of their outdoor space or use more outdoor ventilation to meet the requirements of public health orders and to meet the spacing requirements. So we're knowing that that's a concern, and we've gathered resources for you guys to look at, particularly since we know so many of you are going to be seen as your school's health expert and maybe asked to weigh in on a number of these things. So here's our agenda. We've done the poll, so we have a sense of who you guys are. Those objectives are a little bit about what we're planning on going over today. We have 3, we're going to talk generally about asthma and environmental triggers, and then we're going to go over contents of our 3 tip sheets. One is just generally asthma and management of asthma and environmental triggers in the era of COVID. One is about indoor triggers and cleaning, and the last is about outdoor triggers. and the input that you might be making for your schools. Then we'll have time for question and answer. And the very final slide in our presentation has my contact information and Wilma's contact information. So if you either have stuff we didn't get to today that you want to share or that you want to ask, you're more than welcome to contact us after today's presentation. Or if you think of something later or you get asked a question by one of your administrators and you want us to help you dig up some resources, we're happy to do that as well. We see ourselves as an organization, even though folks often think of us just as school-based health centers, we are a school health support organization, and we work closely with the School Social Workers Professional Association and the School Nurse Association, so we can try to work with those partners to get answers for you guys. So that's our plan for today.
Okay.
And we wanted this, even though this is mostly going to be lecture and review of our tip sheets, we wanted to have an opportunity for you guys to do something a little interactive since we can't see you in person. So I'm going to turn it over to Wilma, and she's going to guide you through a new tool we're using, Mentimeter. So let me turn it over to Wilma John, the program manager.
Hello, everyone. So next steps, we'll need you to go to menti.com. You can either open up two screens on your desktop and kind of put them side by side and do that, or you can pull it up on your phone and get into Menti that way. Once you go to menti.com, enter in the code 1764928. And I'm going to do this. Here we go. So we'll have everyone log in there. Again, it's menti.com and use the code 1764928. We'll give it just a couple more seconds to allow everyone to log in. And so for the first screen of Menti, we're asking everyone to kind of check in where they're at about how you're feeling about school reentry. So go ahead and go and enter in your thoughts there, 0 being strongly disagree or no, and 10 being strongly agree and yes.
Wilma, do you want to navigate over to the Menti instead of the PowerPoint?
Oh, okay. It's showing Menti on my screen. Is it not showing on that one?
No, you may have to unshare and reshare. Not sure.
Let's see. Let me stop share and restart the share. Is it coming up? Okay. Give it just a couple more, about a minute more. I think we have about 16, 17, and how many participants do we have?
We have 31.
Okay. Just trying to give everyone enough time to participate.
In terms of that, taking it day by day, I wanted to share with this group. I was in a meeting today and did hear that PED is planning to hopefully release their COVID rapid response plan today, hopefully before Tuesday. And so as soon as we get that, we will be posting it on our website. We have a COVID-19 sub page that you can navigate to from our homepage. So that rapid response plan, as soon as it's published by the state, we will get up on our website. I know that people are anxiously awaiting that and having to make plans on the fly day by day until they get it. I will say, I don't think that that's going to cover asthma. And so you may be in a position to be advising your school administration about how to factor asthma in to the planning as the local expert.
Okay, so it looks like everyone's taking it day by day. Um, Everyone's about middle ground with filling plans and being a part of the conversation. A lot of people are feeling like we're not totally ready and prepared. So I think that's something that we hear pretty often. Okay.
Wilma,
Uh-huh.
we have a question as far as what the code is to get into Menti.
Okay, right here. Go to menti.com, enter in the code 1764928. Can we put that in the chat button? Okay. Okay, to move on to the next slide. Here we go. Okay. So this one is a word cloud. What comes to your mind when you think about asthma and COVID-19? So it looks like there's a few responses. The bigger the word gets, the more often that the word is shared. And so serious, respiratory, airway, breathing, fear, conflict, worry seem to be higher on dots.
And that makes me really glad we're doing this session. Seems like we all have the same anxiety around this.
Give it a few more seconds. Nancy, do you want to share any thoughts?
Well, I mean, I think you guys are all pretty much on the same page, and this is why we decided to create these tip sheets. I think unintended consequences is maybe what I would have put in to the box for the word cloud. And I think that the fears and anxieties that you guys have, I think are realistic, because if you're so focused on COVID-19, all the other chronic health conditions that students may bring to school may fall off the radar. And particularly if you're focused on the curriculum, or you're focused on cleaning, or you're the guy in charge of the facility, and healthcare is not your field of expertise. So that's why we wanted to collect tools and resources on these topics, so you guys would be armed with the information, or at least know where to go to get the information. And I think some of you will be put in the position to be called upon to advise those folks making those decisions, and other of you may have to be more assertive in sharing the information, particularly if you see young people having those unintended consequences for decisions that folks have made in leadership to try to mitigate the risk of COVID-19. And unfortunately, those things get layered on top of one another. The data isn't out yet on how much of an additional risk asthmatics have of getting or having a negative outcome from COVID-19. And there's some disagreement between national bodies on that, but there's enough agreement on watching and being concerned that I think your concerns that show up in this word cloud are completely relevant. So we hope these tools get you somewhere in that discussion.
Okay, so next we have a couple little fun things. A little quiz. It's only 5 questions. You'll have about 10-15 seconds per question. So if you will go in and enter in your name, and then we'll move on to the quiz. Okay, we're ready? All right, first question. So answers 1 and 11. Next question. Ah! Because they're going back and forth. Good. Asthma is more common in boys than girls. Ah. Skipping it. So Crystal's our winner.
Guys,
Okay, so we're back at a Menti and we'll go back into into the PowerPoint.
Thank you guys for testing out Menti with us. I think it was so excited by its own dance music, it just jumped a little ahead there, but looks like the majority of you knew the answers to the question anyway.
Okay. Okay, so back to general information. I think most of you that are on this call have a general idea of what asthma is. And just a reminder, it's a condition that affects your lungs, again, which is why it's important when we're talking about asthma and COVID. So asthma in New Mexico, there are estimated 45,000 children that have asthma. I think one of the questions in the quiz was how many kids have asthma? So about 1 in 11. And this is important because it affects students. Asthma is one of the top reasons that students miss school. So that's super important when we're talking about how it's affecting our students. Asthma also disproportionately affects low income, urban minority population, which sounds like the whole state of New Mexico. So it's really important. And how are students being helped? Only a third of schools, about 36% of schools have a full-time school nurse, which is really scary when students are having issues or medical things going on at school. That's really important. About 19% of them receive training for asthma. So there's still not a lot of information shared. And when teachers are coming across students that are having issues with asthma, how are they able to support their kids? And oftentimes it's being sent to a school nurse, but if a school doesn't have a school nurse, then there's not really a lot of support there. And approximately 1 in 4, so 25% of public schools have no nurses at all. Again, really important in terms of support for kids. We have a little slide about asthma and smoking. Oftentimes, school-based health centers support students that are in high schools, and use of e-cigarettes or vaping is super high. If we're looking at the YRS data from 2017, more than half of students have ever used a cigarette. That's a lot of students using things that alone might not be so bad, but if they have asthma along with smoking, can complicate and cause more issues than not. Okay.
Wilma, if I could just add on that last slide on the e-cigs, I did get a chance to talk to our Department of Health pediatric tobacco and nicotine department, and they, in their conversations with school districts, they are a little less worried about this than they were in February because so many schools are virtual right now. And unfortunately, one of the side effects of the economic downturn is a lesser ability of adolescents to get the money to purchase e-cigarettes. But once the hybrid model or second semester comes around and middle and high school students come back, and once things get a little bit more to normal, they're anticipating sort of a surge. So we just wanted to make sure we share this information with everybody so you can support the schools and the students. And we at the Alliance are trying to find funding right now to do some support for schools to do alternatives to discipline in terms of students being caught on campus with e-cig so that they could actually get treatment. So that is something we're looking at, and if anybody's interested in that, they're welcome to contact us.
Okay, so how are we working to reduce the burden of asthma? And I think Nancy discussed this early on in the slides or early on in the presentations.
Yeah, and this, one of the things we wanted to do with this slide is identify the American Lung Association as a partner. We participate in the New Mexico Council on Asthma, as does DOH asthma control program reps who are participating in this webinar, and that is an open body that any of you are welcome to participate in. The tip sheets that we're going to be sharing in a minute also include the website that the Coalition on Asthma has created, and that Norma, who's on this, helps put resources there. So if you have resources you want to share on this topic, or if you're looking for resources, that's a good tool for you. We mentioned before Asthma Control Program as a partner of ours in this work. And then also we mentioned RAMP, and there's a number of RAMP resources that are on the tip sheets that were shared in the chat, and that we will be keeping on our website as long as they're useful. So one of the things that we're focused on, you see a number in this bulleted list, a number of approaches. There's lots of people who, and many of you individually working on patient management, clinical management in a clinical setting, pharmacologic therapies, patient education about their asthma action plan and how they manage their own asthma. And where we have really been focused is environmental triggers. And there are a couple of reasons for that. One is that school-based health center personnel are often asked by school leadership to weigh in and do education on any number of health topics. And I know that is similar for social workers and case managers and school nurses on campus. So we've been working to create resources on environmental triggers. Some of our Medicaid managed care organization and insurance partners work on in-home triggers, and the infographic you have here is more about in-home triggers, but many of those are relevant in the school setting, like soft furnishings, HEPA filters, the kind of vacuum you use. Those are some things we've been looking at with partners who can advise their schools on indoor environmental triggers as well. But we hope you'll utilize all the resources of all these partners as you work on this topic. And our next slide talks a little bit about a guide that you can find on RAMP's website, but there's actually two tools. If you see the little thumbnails there to the right, there's two tools you can find on our website and on RAMP's website. The one on the left is the Asthma Environmental Intervention Guide for School-Based Health Centers. Even though that was created in collaboration with school-based health centers, it's really useful for anyone working in a school setting. And a lot of what are in there are, and you see on the left-hand side a page out of that guide. A lot of what are included in there are strategies you can use in your school to support elimination of triggers. And there are specific examples from all across the country about projects that people have done in concert with young people, in concert with teachers, administrators, to reduce those triggers. So there's a lot of resources there, and they're in this sort of at a glance format. So if you don't have time to read this whole guide, you can pick and choose there. It also has a really great bibliography. It even has things like links to places where you can go buy a HEPA vacuum cleaner for a school that meets EPA recommendations and that sort of thing. And then on the far right, can you go one back? Sorry, Mama. On the far right, that tip sheet, RAMP has distilled everything that's in that guide down to these 6 tips for success. So if you need to do an assessment of your whole school, if that's something you're asked to do, you can kind of use these tips for success for initiatives and pilot projects if you're tasked with that, or if you task yourself with that. And that website at the very bottom, you can click through and get to those tools. But as I mentioned, you can get this on our website as well. So the first year we worked with RAMP, and you can go ahead and go to the next slide, Wilma, we really just pushed out that big guide, and we had these case studies from other states. Then we worked directly with RAMP in New Mexico to do some New Mexico case studies. So we also have these available, and you can always reach out to partners in some of these school districts to learn about what they did. You see here Cuba and Pewaukee. The next page talks a little bit about Roswell and Santa Rosa. And I wanted to mention Santa Rosa in particular, because this is an outdoor trigger project. Well, actually it ended up impacting indoor as well, that I think with schools looking to open windows and doors to increase outdoor air ventilation to reduce COVID risk, I think this is something some of you may see on your campuses. Santa Rosa was lucky that their school-based health center coordinator also happened to be a bus driver, and she's in that little picture right there. And the buses where they picked up students, they were idling particularly in the winter. It's very cold in Santa Rosa in the winter, to keep the buses warm for the drivers and the young people. And that the pollution coming from the buses, they're not electric buses, they were gasoline and diesel buses, was coming into not only the outdoor area where students were lining up to get on buses, but also there were a couple of study hall and some other rooms where students were located, and that those fumes were definitely a trigger. So the coordinator and bus driver there, Cara Pacheco, created a project in collaboration with the bus drivers to make t-shirts and door hangers and really educate all of her fellow bus drivers to stop the idling so that that environmental trigger would be reduced for students with asthma and for staff with asthma as well. The other thing they did was partner with the school district to open up a lounge so that if bus drivers wanted to lock up their buses when it was cold, they could go inside and get a cup of coffee and warm up so that they weren't sitting in a freezing cold bus waiting for students. So those are some case examples of case studies that have borne fruit in the state of New Mexico. So you're welcome to look through those if you need ideas for things you can do on your campus to reduce triggers. And I think all of them are even more important now in the era of COVID than they were even when they were done. And we have those on our website, and you can reach out to us directly or these communities if you want to know more about their projects. I'm going to turn it back over to Wilma to talk a little bit more about asthma and COVID-19.
So I think number 2, the tip sheet number 2 is about general asthma and COVID. Again, it is a concern because COVID is a respiratory virus and that affects the lungs, and so does asthma. I think a lot of the information that we found in trying to research how to support students, like we had conversation, Nancy and I had conversations about this. So were they supposed to wear extra thick masks? Are they supposed to double up? Are they supposed to do all these things? And what I did find was that there was not a lot of direction or suggestion for that. And that they were still researching it. And it showed information that those with asthma might not be at higher risk of contracting COVID, but if they do get COVID, they have a higher risk of complications, which is a big concern. A lot of, again, helping with public health and stuff is prevention. So really important for them to continue to take steps to not be exposed or limit their exposure to COVID. Washing hands, wearing a mask, social distancing, still very important to wear a mask even with asthma. I think there's been a lot of back and forth about exercise and wearing masks, and I think currently our public health order is that people wear a mask even while exercising. So super important, again, for those with asthma is not to get COVID. So taking all the steps that they can to help that. Really important for them to know their triggers. In that sheet, there was a lot of triggers even at home. So anything from mold, pests, smoke, even cooking, the fumes from cooking, or perfumes. One of the projects in Cuba, I believe, was to for students to share about wearing a lot of body spray. So that can be an asthma trigger. So really knowing what each individual's triggers are is super important for them. Also, continuing medication is very important. If they need to get into a doctor, they should get into a doctor, especially if it's medically indicated, and not to avoid going to the doctor to reduce their exposure. And stocking up on meds. A lot of the beginning part of it when people were staying home was really important to ask their doctor if they can maybe do an emergency refill on their meds, so that they can go in, or if they can call in a prescription for them. So that was really important. And so this is a tip sheet. Again, goes over the same steps. The tip sheets that are in the chat box, they should be in the chat box if you need to download them. There are a lot of resources and guidance documents that are super supportive. Some of those that Nancy did mention in the last part about RAMP as well. And looking at the New Mexico Council on Asthma website, they have a lot of good information. There are videos and things on there about how to support people or individuals with asthma.
And if I could just point out for you guys that I know you are going to have lots of variables in terms of whether you're going to be educating people virtually or in person. So we have 2 sets of all of these tip sheets on our website. There's one like the one that's projected right now where it's a hyperlink. So all of those blue, the CDC guidance on asthma and coronavirus, et cetera, you can click through or have someone click through and go directly to those websites. But if you choose the print only option on these tip sheets on our website, you can get ones where the websites are written out. So if you're in a position to pass this on to a family, pass this on to a principal, and you want them to have the full web address, you can get that on our website as well.
Okay. I think we will go to the next one. And Nancy.
So this is our tip sheet that is about cleaning and indoor environmental triggers. And we've heard all sorts of different things about what schools are doing to try to mitigate exposure to COVID-19. And it's probably going to look different at every single one of your campuses. Every school building's different. They're different ages. Sometimes you have different age buildings on the same campus. And even though all the districts got money from the public education department to try to address exposure, they're making different choices about how they are addressing exposure. So for example, some schools have enough funds that they're investing in HVAC filters that have a higher rating against viruses. So that may be something that your school will ask you about or has invested in. Other schools just don't have a new enough HVAC system that they can do that. So really they're going to be looking at opening up windows if they want greater outdoor airflow. The other thing that all of them have to do, and they're mostly following CDC guidance on this, that's what the Department of Health in our state and the governor are guiding them to do, is the cleaning guidance. And so that's something we wanted to address here for you guys in case you are asked by your school principal, superintendent, or head of janitorial or custodial staff, what are the guidance, what is the guidance on what kinds of tools to use to clean. And there are some new things, there's full room misters some schools are investing in, but what's interesting is that the guidance is not really any different for asthma before or after COVID. The products that folks should be using are mostly the same if they were already following EPA guidance on those tools. And so if you look at kind of the pale lavender box, general guidance and principles and tools for cleaning, a lot of that is guidance that people should have been following to begin with. Avoiding products that contain bleach, using the EPA's Creating Healthier Indoor Environments in Schools website for recommendations on, what to purchase. EPA even has links to bulk purchase of cleaning materials that meet their recommendations to save school districts money. So these are resources you can pass on to your custodial staff. One of the things that we've been hearing a little bit about that's a concern is people not using the dilution directions that are given, people thinking that if you use stronger, better cleaning solutions, it's going to be more likely to kill the virus. But if you don't follow the dilution, it's not only an environmental trigger for young people who may, and teachers and staff who may have asthma, it also can be dangerous for the custodial staff. So that might be something you could go over with your school administration, particularly if they ask you to weigh in, that those dilution directions are going to be really important for everybody's health and safety, especially students with asthma. The other thing that I wanted to point out is under that same little box If no one at your school is already using the EPA's new mobile app, the IAQ assessment, that is a really good resource. EPA and CDC have tons of resources on this. We just wanted to collect what we felt like were the most useful, so you have one place you can go look at it. And that app, once someone is identified as sort of being responsible for this, can be really useful to look at if they have a plan for cleaning, if they have a plan for what the whole campus is going to do to address COVID exposure. You could use this indoor air quality assessment tool to make sure that none of those plans actually have a negative impact on your students with asthma or employees with asthma. The other thing I wanted to go back and mention in that same section is the ramp guide. And I sort of mentioned this already, that they have some links in the back of the ramp guide about purchasing, for example, a vacuum cleaner. They also have recommendations for cleaning supplies. And we have had school-based health centers who've partnered with their schools. And in some cases, what they've done is some of those companies that are listed in the ramp guide will send you and your custodial staff sort of a one-time free sample. Sometimes custodial staff fear that the green or the non-triggering cleaning solutions don't clean as well. And they really have to try them out first before they become believers, especially right now. They're worried about their own health and, you know, the health of all the students. So that's something that you could support them in doing. Lastly, I wanted to point out this ventilation section, because this is actually, we debated whether to update this section, but you'll see on the next tip sheet we look at, that is actually the more up-to-date part of ventilation. A month and a half ago when we did this tip sheet, people were still trying to figure out what the heck was going on. People couldn't agree on whether the virus was aerosolized or whether it was only droplets and so on and so forth. So there weren't a lot of recommendations around ventilation. That has changed. So Wilma, can you move it to the next slide? So our next tip sheet is on outdoor environmental triggers, but we went ahead and included that little box on ventilation down there at the bottom, because there are now outdoor and indoor consequences for outdoor air quality and indoor air quality, consequences of recommendations being made for ventilation. And the best resource on that is the American Society of Heating, Refrigerating, and Air Conditioning Engineers, which was not a phrase I ever thought I would hear myself say in the education and public health world. But the experts in HVAC have really gotten on board quick to look at how HVAC systems can be a support in mitigating the risks of COVID-19. So they have just about 10 days ago released a new COVID-19 guidance for reopening of schools toolkit. So that is, you've got the little ventilation box that talks about that organization, and then up above in your guidance documents, the second document is their guidance for reopening of schools. So if someone asks you at your school to weigh in on the health consequences of decisions that the facilities folks are making, that is a good toolkit to pass on to them or direct them to. Right above it is another one I wanted to point out that is relatively new. The Allergy and Asthma Foundation of America has a new toolkit, COVID-19 and Asthma Toolkit. Again, that's maybe 10 days old. And unfortunately, the Allergy and Asthma Foundation and CDC have been arguing with each other a little bit about the risks of COVID-19 to asthma patients. So I think they were kind of holding off on making a recommendation because they were trying to get into alignment with one another. And AAFA has just decided they don't care what the CDC says. So they've got their own guidance document there, and that may be useful to you. I think it's really digestible. So it's, I hate to give you guys homework over a Labor Day weekend, a little light reading on asthma environmental triggers, but it's something you could guide your colleagues to. And lastly, I mentioned in this list, you can link through to the downloadable app that EPA has, both the outdoor air quality one and the indoor air quality assessment. But let me go to the first part of this tip sheet and say just a couple of things about outdoor triggers. The biggest number of questions we've been getting are about ventilation and the increasing of, sorry if you hear my dogs going mad in the background, is increasing the amount of outdoor air that comes into the classroom. Lots of recommendations about HVAC, lots of recommendations about keeping windows and doors open. I know there are some elementary and preschools who are even setting up tents and having classrooms outside to meet the social distancing requirements. So we wanted to include some guidance and tools here that you could pass on if your school is looking at that. Because all of those things are good for COVID, but they may not be so good if you have outdoor air pollutants for your asthmatic students. And there are a number of principles on the front there that you might want to think about. And if some of you are school nurses or school-based health centers and you actually have access to the entirety of your asthmatic population's asthma action forms, you could go through there and make a list or create an Excel spreadsheet of their triggers and look at what are the biggest, what's the biggest bang for your buck to address and what is the most likely issue on your campus. If you're in Gadsden and the pecan farm is fertilizing 2 feet from your school window, that's your issue. If you're in the city and you're next to a manufacturing pollutant next door, that's going to be your issue. So it's going to vary for all of you. So we just made a list here of some things to think about in case it's not top of your mind. But if you look at those asthma action plans, it might very well be identified. So proximity of the school and any part of the school, particularly where windows and doors are going to be open, to factories, to agricultural fields. And sometimes for the agricultural fields, it's not just pesticides and herbicides, it's controlled burns. And some of those do happen in the fall. So that's something to be aware of. The proximity of busy roads or parking areas. We talked about the bus idling can be an issue. If you have parents in a carpool lane who are all idling, that can be a challenge for some with asthma. Once it gets into the winter, I know there's our school nurse from Silver. I know there's a lot of pellet burning down in Silver City. I've got family down there, and that's can be an outdoor air quality issue. I know Estancia, that's an issue for those guys. So if you're knowing which way the wind blows and that's the side of the windows that are going to be open, that could be an issue for some of your young people. Proximity of non-paved roads in some of our rural schools is an issue. If you have lots of trucks going back and forth and they're kicking up dust and suddenly all these classrooms have their windows open, that could be a problem. If your school facilities team is also in charge of landscaping, that might be an issue. Some schools subcontract that out, and it might be making a recommendation about having them, let's say your school's closed on Wednesday for cleaning. Maybe they could do the landscaping on that day as well, so that they're not blowing leaves and cutting grass when all the windows are open and the kiddos are inside getting triggered. Obviously, we've had a lot of wildfire impact here lately. That could continue into the beginning part of school. That can make an impact. That at least is often addressed through weather reports and EPA reports so that you can identify it. As well as some of the weather-related triggers for folks and the pollen issues. If you have older students, you can encourage them to download these apps to track some of these triggers. I will say when we've worked with some quite rural schools, often the EPA data or even the weather data that shows pollen and that shows environmental outdoor air quality, it's for the closest big city, and that's not always helpful in your community. So you can get from the EPA, and we wanted to recommend this, some local tracking equipment. You can do a project on your campus where you can get immediate feedback on your locality. The EPA also has a flag project that you can participate in for free, where you get the tools from them to post flags at any time during the day, sometimes multiple times a day, and all of the teachers and staff can see, oh, it's a green flag. We can go out and exercise. We can keep all the windows open, or it's red flag. There's been a wildfire. We're going to shut some of those windows and try to balance the COVID risk with the risk to the number of asthmatic students we have. So that's the outdoor trigger information that we collected. And, we tried to, all three of these tip sheets, I would just say, we tried to use the best possible resources, EPA, CDC, Lung Association, AAFA, the HVAC Association of Engineers, so that rather than you guys just having to be your local campus expert, you can point your school administration to the national experts and say, this is the best practice. This is the guidance we need to use and follow to keep our students safe. So we hope all these tip sheets are useful to you guys. And now we're going to go on to the tip sheet that RAMP created, and Wilma's going to tell you a little bit more about that.
So Nancy mentioned earlier about the different sites, and these are all things that she brought up in discussing things that you should consider. So what are your COVID-19 restrictions? What kind of asthma education already occurs? Is there a school nurse there? Do students have current asthma action plans? And with everyone not returning to school, that may be the last thing on their list of things that are important to consider and make sure that all of that stuff is in. So it might mean trying to raise some awareness about that, or keeping that also in the back of your head about what kind of issues are affecting your students. Is your school district a smoke-free zone? So when we're talking about vaping and e-cigarette use, how does that play into what's going on? And again, COVID is the biggest thing that's on everybody's mind. How are we cleaning? What are we doing? I did a webinar about cleaning, and one of the big things that they really focused on were that your teams, your cleaning teams, your facilities teams are already doing a great job, really building them up and what they're doing, supporting them. Maybe it just means that they go walk around, and while they're walking around, they're cleaning. And that was the approach they were taking with their sites, supporting them in what they're doing, really encouraging them and kind of building on their strengths, as opposed to raising questions about all the things they weren't doing. So that was really important. And again, the RAMP guide is a good resource in terms of asthma triggers and environmental triggers. So these are some things that you can consider. There are some things already made, like this checklist, how asthma friendly is your school? And you can go through it and see kind of rate at your area what's going on there. This thing does also have some resources, and there's the link in the bottom of it if you have a copy of the PowerPoint. And so, and then we have asthma trigger reduction plans. So again, using resources that are already made so you're not having to come up with things again. How are they doing this? Coming up with a plan, how they can make changes, what tools can they use. Here's a copy of the New Mexico Asthma Action Plan, which is on the DOH website in English and in Spanish. So if you need to access that, those resources are already there. And again, all our documents are on our webpage. Please feel free to share the information, utilize resources. DOH has an excellent asthma control program that are really trained in asthma and supporting students, families, and other agencies. So they're there to help support. Do you have anything you want to add, Nancy?
Well, just one thing that, as we've been talking to more folks about this, I know for nurses and nurse practitioners and PAs and so forth, they're really concerned about not being able to use nebulizers. And that's more on the clinical management side of supporting asthmatic students. But that's another reason it's so important to address the environmental triggers so that we don't get to the point where they have an unexpected need for a nebulizer. I've talked to a number of school nurses who are worried they're just going to be having to call the ambulance at this point and send kids with an exacerbation home. And we definitely don't want that. It's not a safe place for them to be right now in the ER. So I know a lot of clinical folks are trying to prepare families to do that at home and might be calling parents to come pick kids up if they need a nebulizer treatment. But the better we can control the triggers, the less likely there's going to be need for that. So I just wanted to acknowledge that I know that's a concern for many of you, is that further aerosolization. And I think I would just, before we turn it back over to Susan, and she'll be managing the questions and answers, I just wanted to ask our partners from the Asthma Control Program if there's anything they wanted to add.
Can you hear me? This is Norma.
I don't think we could quite understand that, Norma. Did you say something? I know you're having some technical difficulties there, Norma. If there's anything you wanted to add, maybe put it in the chat box. But again, I would just encourage folks, we have done projects over time on asthma, but Asthma Control Program at DOH works on this year round. They have resources and expertise that you can call on, as well as us. I know that the American Lung Association has a schools program that's operating right now, and Kathleen Mosley is running that, and she is a great resource, as well as the DOH Office of School and Adolescent Health. The Shaws and Schmaws and Susan Acosta and Kristen Oreskovich are all partners that can support you in this work. But here's where we are. This is my email and Wilma's email. We're both working from home, but if you call our office number, it gets forwarded to us. So you're welcome to reach out to us, or if you need to direct other folks at your school to touch base with us, we're happy to do that. We know this is a really crazy time. We consider all of you guys who are out there in the field working with schools superheroes at this point. We wish you didn't have to be, but we know you are. So thank you for all that work you're doing. And if there's anything you can think of that we can do to support you in that, even if it's just, you know, forwarding questions to leadership in state agencies or digging up resources for you, we are happy to do that. And we really thank you for participating today. Hopefully this will be useful to you, and we just wish you the best of luck in maybe the craziest school year on record. And I think with that, we'll turn it back over to Susan, and she has another poll to do for your CMEs and CEUs, and she's gonna help us facilitate the Q&A.
Yeah, so let's go in here real quick. And first we're gonna do the attendance check, the final attendance check. Gonna go ahead and launch that now. Everybody make sure and answer. Looks like we're still waiting on a couple more people. Go ahead and answer just so you can get your credit. If you have any issues, message me in the chat. Great. And before we go to Q&A, I just want to thank Nancy and Wilma for your wonderful presentation and your generous support of the school health community. For all of our attendees, you will get an emailed evaluation. Usually those come within about 48 hours, maybe a little bit longer with the long weekend. But after you complete the evaluation, there will be a contact form to fill out. Make sure and fill that out, because we have applied for the CEUs. That will be how we get your certificate to you once you are approved. And make sure and check out our other sessions online. If you have any questions, feel free to reach out to me. I can help you with whatever you need. And my email is down at the bottom of the screen, the head htt365@kessjones.com. And now we will go over to our Q&A. Feel free to unmute yourself, ask questions, or post in the chat.
And someone asked about the asthma action plans. We, and I put the website where you can pull those down in English and Spanish in the chat, but we also have them on our website, and the school health manual, I believe, either has them or has links to them as well. And I know school nurses often get the resources through the school health manual. So it's in a lot of places. I have seen a lot of old versions running around out there, including on our website. So Wilma and I have been working to take the old versions down and get the newest version up.
And physicians also carry those asthma action plans.
That's right. And Francis, that's a good point, because I've heard sometimes that, you know, if a student, especially if a student's like middle or high school and a clinician outside of the school is mostly doing the clinical management of their asthma, that doesn't always make it back to the campus, and it's harder, you know, it's kind of like trying to get blood from a turnip to get the copy of the school's asthma action plan. So I know that's something that ALA works on with external clinicians, is try to get them to share that with the schools, and that's probably going to even be harder during virtual learning. But it's something to think about if you're having a hard time getting it out of a student. It may be, but they're being managed by a provider outside.
We do have some links in the chat as well for those of you who are asking. So there have been some links in the chat that you all may want to check out.
I think we all jumped in and put the same link.
If I could ask folks, if nobody has a pressing question, I'm just curious whether this has already, not just asthma in general, but whether you all are being tasked by your school administrations with helping them figure out a lot of these health related. I know education and health can get really siloed, and you guys are kind of at that juncture. And I just wonder how many of you are being tasked with this request for expertise. I see some nodding of yes and shaking head of no. I know you guys, if you're a school social worker or a school nurse, you know, we thought about this in making this presentation. I'm loath to suggest you do any extra work because I know you're already doing so much work, especially if you're one school nurse in a district of, you know, 10 schools, that sort of thing. So, you know, we wanted you to have the tools to be able to respond if you get those queries, and you can choose whether or not you want to, you know, be proactive and tell your district that you have expertise or at least resources in this area to support them. But particularly once they start coming back to in-person schooling, if you see exacerbations, then you may have to step in and say, hey, you guys didn't think about these kids when you were doing the cleaning and all of the things you're doing to try to deal with COVID. And then the one other thing I did want to add, in case we drop off here in a minute, is that I know that the Department of Health is really going to make strong recommendations to get everybody's flu vaccines this year, because that's obviously another respiratory disorder that could be challenging, and it may really throw off the COVID response if students show symptoms of the flu and that matches COVID-19. So we would just encourage you guys to do whatever you can to encourage young people to get the flu vaccine this year if you're in a position to do that. And I know that school-based health centers in particular are preparing to help with a lot of even drive-through shot clinics, even if their campuses are closed. So if you need resources in your particular communities to support that, feel free to reach out to us on that as well.
And Nancy, in the chat box, Amy said that most of the nurses don't get consulted on this. And then Bridget said in Silver City and Cliff, they train staff about asthma and allergies.
And I'm trying to look at my roster here to remember, Amy, where you are. Oh, you're in APS. Okay. And you're the resource nurse for chronic health conditions, and yet you are not consulted. Well,
Yeah.
well, sister, I don't know what to tell you. I will say that I've heard that similar thing from other large urban school-based health centers, not just here in New Mexico, but we have organizations like ours in other states in the country, and you're not alone. If that misery loves company helps you at all, the bigger the school district, the harder it is to make that impact. And I think if you're somewhere smaller like Silver, they rely on the school nurse and HMS who runs the school-based health center, because there's few enough of them they know to go to them. I will tell you, I have been talking to Chris Muir and the school-based health center in APS. We're going to try to meet in the next couple of weeks, and I will bring it up. I won't use your name, but I will bring it up that they need to be thinking about asthma as they make plans. And not all, but most of the school-based health centers in APS are going to stay physically open, even though the schools are closed. So if you hear through phone calls or you know, other contact when they're coming for the grab and go lunches or something like that from young people that they need help, some of the school-based health centers are open, and the ones that are run by the UNM Medical Group, will see any kid at any school of that same age level. So if there's an exacerbation that you can't deal with and you don't want to send them to the ER, send them to the school-based health center, and I will mention it to Chris and tell her I dreamt about it. And
well, and I will say the nurses at the schools, a lot of them have really good relationships with their principals. So at the school level, things can get addressed on a small level. It's more at like that big district level, you know, when the big plans are being talked about and stuff. So, and we did share the information about the school-based health centers being open and stuff with all of our nurses. So they do know that that's a resource and stuff. So thank you for supporting us in that. And I don't think they mean to leave us out of the conversation sometimes, but they just don't always remember.
Well, kind of like everything else, it's not until there's a problem that everybody's like, where's the nurse? Where's the nurse? We need a nurse. Why don't we have a nurse for this?
Yeah.
And so those are the times that everyone runs around looking for the nurse because they don't know what to do about it.
Well, and you know, our organization is an advocacy organization as well as, you know, training and technical assistance. And if there's such a thing as a silver lining to a pandemic, we are trying really hard to capitalize on people noticing what Wilma just said, that, oh, you mean we need school nurses? Oh, you mean having more health providers on campus would be a good thing? We're trying to push that, and bless their hearts, the National Association of School Nurses is getting op-eds in the Atlantic, the New York Times, Newsweek magazine, and I've been pushing our national organization to do the same thing, because suddenly people are realizing school social workers and school nurses are, you know, our heroes on the front lines and our first responders, and it's nice to hear that. So we're going to push as hard as we can, and we've already talked to the School Nurses Association, I think, and we share a lobbyist with the School Nurses Association. We're going to be supporting their effort to mandate a school nurse in every school district in this next legislative session, because we think it's so important. And we don't have enough healthcare providers in the state for every school to have a school-based health center. We want to see that expand, but I think school nurses are really, and school social workers on the behavioral health side are really going to be the first responders. And just one last thing on that note is, it's just such a chaotic time. I mean, that's why it was important for us to do this today, because people are just flying by the seat of their pants. I mean, it's not just this person in APS is not talking to this person in APS. I mean, this person in DOH is not talking to this person in PED, and we're having to figure it out. School starts on Tuesday. So it's a unique and challenging time, and we just wish you guys all the best. Take care of yourselves so you can take care of the kids, because we know that's all of our goals.
Bridget, did you have something you wanted to say?
Yes, Wilma. When you were talking about how the school nurses are not always consulted, I have 22 years of experience as a school nurse. I was in Loving, New Mexico at one point, and now with the Silver City schools. And at the beginning of the school year, the superintendent was asking the school nurse to do a training of all the staff. And I have done the training every year. And we are doing it also. We are doing videos. We have the training for for a student to use an asthma inhaler. We do the epinephrine at the same time, because we also touch on the allergies at school. And so I thought that it was a mandate that the public schools in New Mexico had to have that presentation at the beginning of the school, because we do have a high incidence of children with asthma in our state. So anyway, this is what I wanted to say. And the other thing that I was going to ask all of you is, we have guidelines on reentry, and we will be the ones, doing the assessment of the students. That when they are sent, we have a clean room and what they call an isolation room, which is really not feasible in our school. So when we assess a student who is coughing in the classroom because the teacher don't know if it's going to be a common cold, if it's going to be an asthma, and we know our kids who have asthma, so we will assess them. But what about when we give the asthma treatment, because they will have inhalers? And again, the nebulizer, I have kiddos with a a nebulizer treatment because they have an IHP, because they are in special ed. So if they have an event like that, and we are in a rural area with a lot of pollen, and I have asthma, so I know that the triggers, but it's not feasible that we are going to eliminate those triggers. It's not feasible. So how are we going to recognize? And the guideline is that if a student is coughing, that could also be, a symptom of COVID. So we ought to send the kids home, regardless of whether they have. So what would be the protocol? Do we do a treatment, send them back to class, or send them home at the first cough? That's my question.
Well, I think there's a couple of questions within that question, and I know a little bit, just enough to be dangerous about all of it, probably. I think most folks are recommending, and I can't remember if this is a strict mandate in the reentry guidelines, no use of nebulizer, and I know in some states what they're doing is they're having almost not a clean room, but a separate room for nebulizer that has a separate ventilation system than the rest of the school. And so if you have some school-based health centers are in a portable, so you might be able to accomplish that. Or if you have a building that hasn't been used, that sits empty, you might be able to do a nebulizer treatment there because the HVAC systems aren't connected. Other folks are just going to send kids home if they need a nebulizer treatment. So I would say Susan Acosta at the Office of School and Adolescent Health could refine that answer in terms of what the expectation is a little bit better on nebulizer treatment. On the rest of your question, in terms of more like a rapid response, like the cough, and how do you determine if it's a cold, is it the flu, is it COVID, is it seasonal allergies, whatever. I believe, but I have not seen it yet, it's supposed to come out today, that PED's rapid response guidance is supposed to address that. Okay. And I know there has been a lot of back and forth on that, and that's why it has not yet been published. It was supposed to come out on Wednesday, then it was supposed to come out on Thursday. Now I hear it's supposed to come out today. It might come out on the weekend, but it's my understanding they're going to address that. And I will say that in your case, with HMS being there and having school-based health centers, even if you don't have one like at the elementary campus, those guys are looking at rapid testing. So as soon as they can find rapid testing that they feel is accurate, schools are, I think, going to be one of the first places to get those rapid testing systems. If you don't have a school-based health center or a health partner in the community that's going to come there and physically do it, that may or may not help you. But at least for those of you who have school-based health centers, that is something that folks are looking at. There's argument in the medical community about, how sensitive or not sensitive the currently available rapid tests are. So it may be a little while, but I heard in a meeting today that there were a couple of federally qualified health centers that are already going to go ahead and invest in purchasing those. So I think that will help, that at least maybe that student, if they're misidentified because they have asthma or allergies, they might not have to miss 2 weeks of school. They might be able to get a rapid test and be back in the next day. I'm hopeful about that. But like I said, we'll post as soon as we get that. I would hope that they're going to send it all to all the districts, but that doesn't mean your district's going to send it to every school nurse and school social worker. So, maybe check our website Monday or Tuesday and see if we've got it up there. I would hope it'd be on PED's website, but that has been a little slow to get the latest things. So I don't want to promise what I don't know to be true. I hope that's helpful, Brigitte.
Yes, it is.
Brigitte, I had a question for you. You mentioned that you guys made videos on some of that training. Is that something you could share with us so we could share with your colleagues? That might be really useful for folks to see.
It's a YouTube video that was made, and we are sending it out to all the staff in our school, and then they come in the office and they get checked on the use of the inhaler and the epinephrine. We have a trainer for that. So yes, I will find it as soon as I get out of there, and I will send it to you guys. Okay.
That would be great.
Yeah, there are 3 or 4. They are in the form of PowerPoint, some of them, and it's our director of nurses who has, come up with that, and so we use it, and it's very useful for the students as well in the high school. I use it in my health class or something like that, for information. Um, the, you did answer, and I remember now that the superintendent is going to send us all these guidelines from about the rapid response. So I don't know when that is going to come. But the thing is that, yes, I was aware that we may not have to use the nebulizers. And, but what about the inhalers with a spacer? The recommendation was to use a spacer. And I was talking to the respiratory therapist from HILA, the medical center in Silver, and she was giving me some pointers on how to cover, the spacers and all that stuff, the mask, putting a mask on the students and doing all that. So that might mitigate, the aeros. I know how to spell the word, but I cannot say it. Aerosolize. Yeah. So anyway, so do we do that then? We send the kid, but if a kid is in crisis, I am going to use what I have in my office, to be able to, to help the child, because a lot of times a kiddo who is running on the playground will have an asthma event, and they bring me the kiddo because I have the inhaler, because the kiddo is too little to carry his own inhaler. So, but we do have a plan, we have action plans that they are not to send the kiddos, that they have to, keep the kid and contact me so that I can go and do what I need to do in the classroom. So now, if it's a child who is coughing because it's something else, but the teachers know who the kids are in their class who have asthma. So that's one good point. Then we have the plan. What is it that they have to do? A, B, C, D, and contact the nurse right away. If the kid is turning blue, bypass the nurse, call 911. But call the nurse also. And so, and there's only one nurse, for the school, which is not a lot of students anyway. But this is the thing, we are, racking our brains, school nurses in the district. How are we going to be able to respond appropriately to all these things? We're going to be, I have only 2 cots in my old office. My clean room, I'm going to use it as my separating room because of the fact that there's a bathroom in there. Whereas the cubicle that is given to me as an isolation room has no ventilations, no door, and there's not enough room for a bed or a cot. So if I have a child who is really ill, waiting for a parent to come and get them, if they are nauseated, if they're vomiting, if they have diarrhea, which are all those symptoms that we have to look for. Anyway, I'm ranting here, and I'm very sorry for taking you guys' time, but these are all the questions that are, coming to us, and we don't know. Well, I know what I need to do, but again, we are not doctors, we're not nurse practitioners, we are nurses who are following, guidelines and orders from doctors.
Bridget, I think the frustration goes statewide as far as isolation rooms. Some of our isolation rooms here in our district are just storage closets. So, yeah, I don't know if they don't take it serious enough or there's budget restraints or what it is, but it's, we take it serious and we're trying to help them. I don't get it either. So I think the frustration is just statewide, period.
Well, it's disheartening because now there's going to be this fear of everybody. One little kid is going to be in the classroom with a runny nose, the teachers are to send the kid to contact the nurse so that we can go and get the kid. And what are we going to do? We're going to put a PPE, we're going to put a gown for each child who has a cough. This is absolutely, it's crazy. It's really ridiculous at this point. I am glad that we are, able to talk to one another about that, because I want to help the students. And I do have kiddos with asthma events that are pretty serious at times, because, they come to school with a cough, parents maybe smoking in the car when they're bringing them, or for whatever reason, and so they may not have a fever, and that would be the thing. If they had a fever, we would definitely send them, but just a cough, and we have to send the students home.
Hmm.
And do we require the parents to take them? I mean, I can see the frustration of parents taking the time to take the kid or to a clinic. Sometimes they don't have an appointment for days.
Mhm.
So that
And the temperature, coming back to the temperature, our district is not allowing the temperature to be taken at the forehead anymore. You're taking it at the wrist. And yeah, because there are some people that are complaining that it is
threatening.
It's pointing a gun to their head. And yeah, that's Nancy, that is exactly what I felt.
Yeah.
There's a big discrepancy between a wrist temp and a forehead temp. And yeah, the best way to get a temp is oral, probably. But yeah, they're not being allowed to do that anymore. So you got me. I don't know.
Well,
We're not
one thing
just reentry.
Brigitte, if you wouldn't mind, Head to Toe doesn't share your email addresses with us to protect your privacy, even though we can see your names. If you wanted to do a private chat, or you see our email addresses, email Wilma and I your email. I think I could probably get more clarification on the inhaler and spacer for you. That is just not my area of expertise, so I hate to answer that. I haven't heard as much about that as I have the nebulizer, I will say, but I think it's important for the question to be asked of DOH. The other thing I would say, and this may feel like screaming down a well, but if you get the rapid response guide today or this weekend sometime, and you see it doesn't address those things that you guys are bringing up, I would encourage you to either call that PED hotline that they have, or hopefully the response guide itself will have some email or phone number to call to provide input. Or we could work with the School Nurses Association to provide agency input from folks, because I fear, call me negative Nancy, but I fear that some of those things will not be addressed. I'm not sure there's been enough field input to what's included in that rapid response plan to address every single, I mean, it's extremely complex, and given that school buildings are so different, that complicates matters further. But I think you guys know your schools, and you know what it's going to look like, and you can imagine it in a way that folks who are not in the field cannot. So I'd encourage you to share that feedback with PED, get them to give you answers to the degree they can. Because, for example, this is just an example, I've heard some schools saying, well, we're going to use our gym, we're going to relocate physical activity, PE classes, et cetera, and we're going to use our gym as our clean room because there's the big fan, exhaust fan, so that helps with ventilation. If we have 10 kids, we can physically distance them in the gym. But they haven't thought about what you just brought up, which is the GI symptoms. So are the kids going to have access to a bathroom close by if they're using a gym? So I think if they don't have medical input from people out in schools, there may be things that they miss, and they probably are aware of that. So I would just encourage you guys to put those questions to them so they can give you good answers, and it might help them rethink the guidance. My guess is they're going to have to revise this thing a number of times as schools open and things happen.
Yeah.
Nancy, it was, the guidance was actually up for about 30 minutes this morning, and then they took it down to already make a correction. So I just
I
haven't.
don't suppose you got it, did you, Amy?
I did. So, so I have read it already today, and the things that you guys are speaking of right now are not really addressed. Because these are like the very like specific details and stuff. I feel like it was what I read, and I mean, we'll have to see what corrections are made, but I know that what it really addresses more is about how we are to report about positive cases and sending kids home, how long they need to stay home, what do we do when staff is sick, more of that kind of thing, not this real detailed of like, you know, who goes to what room or what should the isolation room look like. I didn't see that when I was real quickly able to like look at it this morning. I did download a copy. I don't know because they obviously took it down because they needed to make some revisions already. So
yeah, well, yeah, it may create anxiety disorders in us that we don't need to look at the first draft, but I think even whatever final they come through with, there's just a million permutations to this that it'd be impossible for them to think of everything. So if you guys can give them that feedback, there is a medical advisory team with DOH, PED, and Medicaid all working together. So I'm working under the assumption that that's the team that would look at those questions and try to address it. And they may not republish another guide. They may just answer the individual schools question, but that doesn't help all the other schools for whom it's going to come up. So we're trying to, without sticking our big noses too far into PED's business, trying to help and get information out to the field. So whatever you can share with them that they may have thought of, I think would be good. In the meantime, I'll be honest, part of what Wilma and I have been doing is looking at other states, and I have talked to a couple of school board members and principals who are doing the same thing. States that had surges earlier, I think, started this work earlier, and so they have rapid response plans. I mean, you can't follow what they say to do in terms of contact tracing and what you have to report to DOH and all that kind of stuff, but if it's clinical and it's about your clean room and PED's not providing guidance on it, you might be able to look at Missouri or Connecticut or New Jersey or somewhere where they've had kids in summer school and have had to get on top of this a little bit more quicker. I hate to say that, but it might be your only option, at least in the interim.
And we also have our school health advocates, from each region in New Mexico. I'm region 5, and we look at the positivity rate and see what's going to happen. But really, we are looking to see what's going to happen a week after Labor Day, because that's when we are going to come back hybrid and see if there are enough uptick in the cases in our area. And that probably will be closing the schools again, if we are going above the 5%. Anyway, somebody needs to get off, so I better get off, sure, so that we can have the questions and the evaluation. Thank you so very much, everybody.
Thank you so much. These are exactly the issues we wanted to try to help with, but also hear from you guys so that we can go back and tell our contacts what work there is still left to do. And clearly there is some. So we really appreciate your time and attention. If anybody's earned a good Labor Day, it's you guys. So thank you so much. And Susan, should I turn it back to you?
Yeah, everyone's good to go. We've counted final attendance. Everyone will get an email probably early next week with the evaluation information on CEUs, and make sure to check out our other sessions, but otherwise we're good to go. And then you also will get the PowerPoint and the handouts in the final follow-up email as well.